Hello everyone, in this video we will discuss about Huntington's disease. Huntington's disease is a neurodegenerative disease. It is the rare type of neurodegenerative disease which involves the basal ganglia, especially the caudate lobe. There is the atrophy or damage of the caudate lobe which results in the decrease in neurotransmitters like acetylcholine and GABA. It is autosomal dominant type of disease. It's, it involves chromosome number 4 CAG gene. There is increased number of CAG trinucleotide. The normal is 27, but in Huntington's disease there is more than 35 repeats. How can we remember this? Let's remember there is one hunter who loves hunting. He hunts monkey and put it in the cage and asks monkey to dance. The cage means CAG. This is the trinucleotide repeat. CAG trinucleotide repeat. There will be more than 35 repeats. And the wall, there are 4 wall. Chromosome number 4. Dance means chorea. It is the clinical features of Huntington's disease. It usually involves the age more than 40. Death is within 15 to 20 years. It is so fatal. We can see there is one phenomenon called anticipation phenomenon in Huntington disease. This means if the grandfather had Huntington disease at the age of 70, his son will have at 50, then his son will have 40, his son will develop symptoms at 30. Like within the generations, the symptoms appears more earlier. Let's see the clinical features. Initially, or early clinical features are chorea. Chorea means irregular, sudden, non-repetitive dancing movements. Athetosis. Athetosis means involuntary writhing movements of the hands and fingers. Nystagmus, hyperreflexia, urinary incontinence. The advanced features are hypokinetic motor symptoms like dystonia, rigidity, akinetic mutisms like inability to move and speak, motor impersistence, inability to sustain simple voluntary act. If you ask the patient to protrude the tongue, then he cannot protrude the tongue for more than 30 seconds. Cognitive decline. There will be dementia, major depressive disorders, schizophrenia like psychosis. Now let's see how can we diagnose. Diagnosis can be made by clinical features and genetic testing, that is PCR. There will be repeat in the CAG trinucleotide. We can do imaging, CT or MRI, which shows atrophy of the caudate nucleus. MRI shows boxcar ventricle. Or we know there is decrease in the GABA and acetylcholine due to atrophy of the caudate, which results in the increase in dopamine, which might shows hallucination in some patients. Now let's see the treatment. We have treatment of the depression, agitations, chorea and all. Non-pharmacological treatments like non-use of helmets, padding, reclining chairs, low beds, protective padding of the environment, minimize stress. But if the patients develop chorea as well as depression, we should use second generation antipsychotics like risperidone, aripiprazole. But if there is no depression, then we can use tetrabenazine 12.5 mg daily or deutetrabenazine 6 mg BD. If there is psychosis, then we can use quetiapine 12.5 mg daily. We can try it up to 25 mg. If there is depressions, then we should add SSRI like citalopram, and we should screen for the suicidal thoughts. The most common cause for Huntington disease with psychosis features is suicide, so we should screen. The prognosis is progressive. The mean duration is 10 to 20 years after the symptom onsets, and most common cause of death is respiratory problems. Thank you.